Now, a patient walks into your clinic, or you basically encounter a patient while you're in an emergency ward department round, that basically a person has presented with a sudden painless loss of vision. Either it is involving a unilateral eye, or either both the eyes are involved bilaterally in this sudden loss of vision. So what are the causative factors, or what is the differentials in this particular case that you're going to sort them out? It can be basically any causes that are relating to the cornea. It can be the lens, and then we have the retinal detachments. That can be one of the causes. We can have the macular degenerations, and then we have the retinal artery occlusions, or the optic neuritis is one of the major causes of the sudden painless loss of vision in this particular case that we're talking about. So usually the sign and symptoms, which are the highlights of the central retinal artery occlusion, are the sudden loss of vision. Then we have the painless loss of vision. The person would usually give you a history, or when you take out the systemic history of this particular person, the diseases that are going to be highlighted, either the person is going to be suffering from fever, or will be a diagnosed case of endocarditis. He or she may be suffering from some sort of an autoimmune disorder. In these cases, the retinal artery occlusion is caused by the giant cell arteritis, which is again autoimmune in its origin. So again, what can be the other causes which can relate to the development of the central retinal artery occlusion? It can be the atherosclerosis. If the patient had a history of atherosclerosis, the dislodgement of the thrombus can be caused, and it is going to basically hinder the blood flow to the retina. The central retinal artery is going to be occluded in this case, and it is going to present as sudden painless loss of vision, either unilaterally or bilaterally, and mostly it is unilateral in its origin. So these are one of the causative factors over here, and these are some of the signs and symptoms that we have to be aware of when we have this patient of sudden painless loss of vision unilaterally. Knowing the epidemiology of any disease basically gives you an insight towards this disease. How prevalent it is again very important. The incidence rates are again very important. Whether it is more prevalent in males or females is again very important. These are the different researches that have been carried out on different pathological conditions or different pathological phenomena over here. And so knowing the epidemiology of the central retinal artery occlusion, we'll just quickly or briefly go through the epidemiology of this disease. Now, knowing the clinical features, so once you have basically gone through the clinical features or the signs and symptoms, these signs are obviously observed by the clinician himself or herself, and symptomatologies are basically described by the patients in his or her own words. So knowing the sign and symptoms of any disease makes it very easier to narrow down the diagnosis in this particular case. So knowing this clinical features, we'll just quickly go through the signs and symptoms that are particular to the central retinal artery occlusion in this case. As we've already discussed, that the central retinal artery and vein is basically entering the orbital cavity, and it's basically a branch of the ophthalmic artery, which again, in return, it's basically a branch of the internal carotid, and the ophthalmic artery is basically the first branch that the internal carotid artery gives off. So any blockage that occurs during the course of this artery, and that is going to hinder the blood supply to the retina, and if the hindrance is severe enough that it is affecting the inner retina, then only we can say that the central retinal artery occlusion has occurred. So this is the basic definition of this condition, how prevalent it is: approximately 8.5 cases per 100,000 cases that have been reported of unilateral, sudden, painless loss of vision in this particular scenario, largely seen in the older adults. So the age group that is particularly affected because of the central retinal artery occlusion is the older adult age group that is mostly affected. And why is this so? This is basically due to the phenomena that atherosclerosis, all of the autoimmune diseases are more prevalent in the older adults, and that is why even endocarditis is more prevalent in the older adults. So the risk factors, they are basically prevalent in the older adults, and that is why it is making this particular age group more prone to the development of the this condition. Usually the patient is in his or her early 60s. Men are affected more frequently than women. So it is usually an old age man that is mostly affected due to this central retinal artery occlusion when we talk about it. 1 to 2% of cases may manifest bilateral involvement. So usually it is a condition which is affecting unilaterally, but in almost 1 to 2% that is basically making a very rare case. In a very rare case, it can be a bilateral involvement even seen in some patients. The causes, we can basically define or we can categorize the causes into thrombotic causes on one hand, and then we have the embolic causes on one hand. The thrombotic causes, they basically formulate almost 80% of the patients who are presenting with central retinal artery occlusion, and in only 20% of the embolic causes are seen, and that is basically making the way towards the central retinal artery occlusion. Again, when we look at the causative factors behind these thrombosis and behind this embolism, there can be a range of factors that can be present. It can be different systemic illnesses or different systemic diseases that can be prevalent in that particular patient whom we're talking about, ranging from atherosclerosis. Then we can have a history of endocarditis, or the patient can suffer from spasmodic palpations in the retinal artery that can basically cause the dislodgement of the thrombus, and again it can cause basically the hindrance of the blood supply to the retina, and in that case basically the inner retina is affected, and it is basically severe enough, the ischemia is severe enough to affect the visual fields of that person, and it finally presents as a sudden painless loss of vision unilaterally. So a history taking, of course, is the mainstay over here, just to rule out or just to narrow the diagnosis. When you take the history, the genetic history is again very important. The family history is very important, making the person more prone to the development of a particular disease, or the atherosclerosis or endocarditis or giant cell arteritis again. And then we can ask the patient of the systemic history, which is again very important in this particular case. So knowing the person is suffering from some sort of atherosclerosis or has risk factors to the development of atherosclerosis is going to narrow the diagnosis in this particular case. The clinical features would range from monocular loss of vision. So usually the typical picture that is seen in the central retinal artery occlusion is a unilateral loss of vision. There is a sudden loss of vision that is observed in these individuals. And then there is going to be a severe visual field defect. Sometimes the peripheral along with the central visual fields are affected in this particular case. And then we have the painless loss of vision in these people. It occurs acutely, possibly over the span of a few seconds. So it is sudden enough that it can be, the span can be over a few seconds, and the patient would give you a history that he or she was perfectly normal and there was a sudden acute painless loss of vision unilaterally. So this is the typical picture that is seen in these individuals. Amaurosis fugax is one of the signs that is seen on the fundoscopy, and that is basically leading towards the pallor of the optic disc, and that is the highlight, and that is basically one of the factors that can make the diagnosis narrow enough, and we can make basically a definitive diagnosis of central retinal artery occlusion if we have amaurosis fugax that is seen in these patients. As you can see over here, the pathology of the formation of the central retinal artery occlusion is shown in this diagram. It's basically a plaque formation. Over here, when we look at the diameter of the central retinal artery, it is basically showing a normal versus a blocked artery in which the blood supply is blocked, and is due to the formation of the plaque, and plaque formation is again due to the atherosclerosis in these particular patients that we see. So after this pathology has started, and it is basically the blockage is severe enough that it is basically affecting the inner retina, that is when we say, or that is when we diagnose these particular cases as central retinal artery occlusion or suffering from central retinal artery occlusion. Visual acuity sometimes is affected to the level of counting fingers to light perception in these cases. Central visual acuity is near normal in these patients. Usually, the peripheral visual fields are affected in these cases, and the central vision is quite normal in these cases. The absence of the light perception is quite rare. There is a concomitant choroidal circulation deficit that is seen in these individuals. So when we perform these tests, that is basically the counting finger test, and we perform the visual acuity on these people who are suffering from these CRAO, the visual acuity is going to be normal, and the visual field that is particularly going to be affected is the central, it is going to be the peripheral visual field that is going to be affected more rather than the central visual field. There's going to be an absence of the light perception that is also seen in these cases. So the intraocular pressure may become elevated in the setting of the rubeosis iridis. Rubeosis iridis, when we look at this, basically it's the neovascularization, or we have, when we examine the iris closely, there's going to be formation of this rubeosis iridis in these patients. The fundus changes would include cherry red spot appearance. So fundoscopy is very important. It's very critical in all of these cases. And the cherry red spot appearance is very common in these cases. Almost 90% of the patients, we see this cherry red spot appearance. Then we have the posterior pole retinal opacity or whitening that is basically observed in almost 58% of the patients. And when we have the box scarring of the retinal arteries and the veins, it's again one of the phenomena that is seen on the fundoscopy. It's basically showing the hindrance or the blockage of the arterial supply to the retina. And this appearance is basically known as the box scarring appearance in these particular cases of the fundoscopy, in which we are basically looking at a central retinal artery occlusion in this particular case. Retinal artery accentuation is one of the phenomena that is seen in these cases. And this is again due to the fact when we say that rubeosis iridis, this was basically due to the new vascularization because there was a hindrance of the blood supply from the main arteries, and that is basically compensated by the accentuation of the other retinal arteries that is observed in almost 32% of the patients. Then we see an optic disc edema. And along with that, we see the optic nerve pallor that is observed in almost 39% of patients, and the optic disc edema is observed in almost 22% of the patients. Over here, we can have a look at the healthy optic nerve versus a damaged optic nerve. So when we basically compare this healthy optic nerve with a damaged optic nerve, it can be one of the causative factors, can be the blood supply, and it can be the infections, or either it can be the giant cell arteritis, which is basically causing this optic neuritis, or this deranged or damaged optic nerve, which can again present as the painless sudden loss of vision. And again, the loss of vision is of a unilateral kind in these cases. So over here, we basically went through the typical clinical picture of the central retinal artery occlusion, and how is it basically affecting the person, and how can we basically differentiate or narrow down the diagnosis in a person who is presented to you with a painless sudden loss of vision, and again, the sudden loss of vision is unilateral. So that is the end of this section. Thank you for watching sqadia.com.